Namaskar, Assalamu alaikum, Sat Shri Akal, Vanakkam. Welcome to our next session of autoimmune disease, ladies and gentlemen. And at the outset, I thank the three persons who have made this and all my Zoom sessions possible. Dr. Fatima, my wife, Dr. Pratibha, and Dr. Dhara. So thank you very much. Today is 18th of Jan, and it also happens to be the birthday of my student, one of my students who was a very, very good practitioner of Chandrapur. He passed away 6 months ago, Dr. Pritesh Gorkar, and he has attended our schools. So people who have attended with him a few years ago must know. He is no more with us, but his memories are still on. So I dedicate this lecture to his memories. Ladies and gentlemen, for you, autoimmune diseases part 2. So before we start with today's session, let me do a recap of what we did last time. So autoimmune disease is the curse of our times. We saw what is the concept of self and non-self, and what the curse of leprosy was in the last century are the autoimmune diseases, the curse of this century. We saw the mechanisms and the working of T cells, B cells, and something about human leukocyte antigen or HLA complex, its role in susceptibility and resistance, what is autoimmunity, what are antibodies, and certain cellular characteristics of autoimmune diseases. Then we talked about causes, and today I'm going to elaborate on using those causes in the management of diseases. So this will be a big slide. So we saw the various causes: emotional, drugs, etc., the maintaining causes, and we saw in brief the miasmatic assessment of autoimmune diseases when an immune disease is in a soric phase, a tubercular phase, a psychotic phase, or a syphilitic phase, and drug miasms. We also saw two drugs, potentized cyclophosphamide and potentized methotrexate, which we have been using quite frequently. Likewise, with potentized azathioprine, cyclophosphamide, and rituximab. There are a few others which I have potentized and use it very frequently in clinical practice. Then the general symptoms of autoimmune disorders, any autoimmune disorder, particularly those with systemic symptoms, can have these general symptoms. The results, certain organs affected, lab investigations in general, ESR, CRP being more important. Then management goals. We have seen all those things. And the first part of management, that is how a history is taken and the staging of disease as emergency case or life or distressing acute symptom, which we have to tackle. A virgin case, we have to find the person in the patient who is newly detected and no other therapy is taken. Already diagnosed SLEK or autoimmune disease and on one or more therapies. Any autoimmune disease with other comorbidities like hypertension, diabetes, so on and so forth, plus the drugs and the clinical biochemical response of those drugs and the comorbidities on the entire organism. Steroids, immunosuppressant, either dependent or resistant AIDs, and complications of the disease per se, of the drugs and both. So from here, we now take off to today's lecture. And that is Autoimmune Diseases, the Curse of Times, Part 2. Stay with me till the end. Today is a hectic session. I'll try to go slow, but because there's about 100 diseases, 100 autoimmune disorders, so I may need to rush up a little bit. Now, AID is based on response to homeopathy. So I was wondering, how should I start? I mean, because they're so varied AIDs. So these, I wanted to classify them. So this was the best classification I could come up as a clinician. So certain disorders by the name of, I mean, these names, and of course we'll talk about the total, the symptomatology also. So alopecia areata and totalis, you can attempt to cure it with homeopathy. Lichen planus, yes, of course. Psoriasis, not always, but mostly, yes, you can attempt to cure. Ulcerative colitis, Hashimoto's thyroiditis, Guillain-Barré syndrome or Guillain-Barré syndrome, whatever you want to call. So these are certain autoimmune disorders wherein you can attempt to cure. And then there are others like nephrotic syndrome, rheumatoid arthritis, SLE, and so on and so forth, where you can give the patient a significant long-term palliation. And then there are a few others where it's homeopathy alone is not sufficient. You have to take part. Homeopathy becomes just a small part in the entire therapy, like allopathy or Ayurveda, physiotherapy, and so many other pathies. So homeopathy just becomes an assistance to other systems, like acute glomerulonephritis, in which we can have IgA nephropathy, glomerulonephritis, focal glomerulosclerosis. These are big names. When we come to this disease proper, we'll speak about it. Then there were MS. MS is not mitral stenosis, it is multiple sclerosis here. Multiple sclerosis. Myasthenia gravis, diabetes type 1, Graves' disease, and number of other diseases whose names I have not taken. So these are certain diseases where we have to actually look upon. So there are general AIDs, that means autoimmune diseases with systemic features, like systemic lupus erythematosus or systemic sclerosis. The name itself means system-wide. It involves all the systems at the same time, or most organ systems at one period of time. So it's called systemic lupus erythematosus, which we are going to talk in detail today, and systemic sclerosis. So SLE, systemic lupus erythematosus. So as the name implies, it is system. It involves multiple systems at the time. Lupus. The word lupus actually means a wolf. And the wolf has a characteristic of attacking suddenly and very violently. It does not give the prey a chance to escape. Initially, the word lupus has been used in our materia medicas, in our repertories, and in old literature as tuberculosis, because formerly tuberculosis was one rampant disease which used to attack suddenly as to actually devour the entire organism and take hold of the entire constitution. Either the patient used to suffer for a long period of time, or many could lose their lives. Yeah, SLE does not kill you immediately. It is one of the most clinically heterogeneous. This disease truly signifies the tubercular miasmatic state, wherein the diseases are very erratic. The symptoms are quite erratic. They're random. No symptoms are repeated again and again. One organ system may be affected, and suddenly the next time the second organ system is affected. So there is no continuum of the disease. This is SLE for you. Clinical heterogeneity, unpredictable course, and when the disease will flare up, one may not know. And with this, we have to deal with homeopathy. Although it's a systemic disease, SLE, but sometimes in some people, we can have an organ dominant SLE. That means it can dominate. Like few of our SLE patients were first diagnosed when they were having habitual abortions. This is a very common. The female-male ratio is 9:1. That means it affects 9 females to 1 male, SLE. And many females come with habitual abortions or missed abortions. We do a certain test called ANA, anti-nuclear antibody test, or dsDNA. There is double standard DNA. which is a hallmark of SLE, and you find out that they have SLE. So, one organ system can be affected. Certain people, so like we'll see what SLE is probably. 70% follow a very relapsing and remitting course. That means for a particular period of time, they have remission, the disease is under control, and certain few months or years, you can have a great relapse, a flare up in that, sometimes ending up in crisis, sometimes killing an organ or failing an organ system. Now, again, when I was talking, I was thinking about SLE, how to present SLE. You can have that typical book picture, but then in clinics, we don't see SLE as book pictures always. We may see the inflammatory stage of SLE, wherein the most important symptom would be easy fatigability or exhaustion. A patient may say, doctor, I could do my routine work very easily, but now I'm exhausted. By afternoon, I need to sleep. I never slept in my entire life. I've never slept in the afternoon, but I just can't sustain. So easy fatigue. And then there is something called feverishness. In Hindi, the patient uses the word haddi mein bukhar rehna. That means when you measure the fever with the thermometer, you don't get the temperature. But the patient continuously feels feverishness. So if you have a persistent, prolonged fatigue without any cause, your appetite is good, your thirst is good, and yet you are having fatigue. And then you have got feverishness. Now, these are very similar to tuberculosis, which was initially in the past. Even today, tuberculosis can, if a person is affected by tuberculosis, you may not have the classical symptoms of tuberculosis. You may have these two symptoms, fatigue and feverishness. Over a period of time, the patient says, no, okay, sometimes they take some painkiller or fever therapy or something, and they continue to prolong this. Over a period of time, then they start developing fever proper. Initially, the fever is very low-grade fever. It may come in the evening or at night or early morning, and then it starts to be present throughout the day. Slowly and steadily, as the disease progresses, the miasm evolves from SORA to sauropsychosis to sauropsychosyphilitic, or psychosis grows more and SORA comes less. Then you start having a typical butterfly rash on the cheek, which they call as malar rash or butterfly rash, or this is a hallmark of SLE. If you see someone with a slightly brownish color rash, it is not melasma, it is not cloasma. Cloasmas are this way. Whereas the SLE rash starts in the center like a butterfly from the nose, and then it involves the cheeks. And in the entire course of SLE, 90% of cases, this will remain. So it doesn't go once it has come. So immediately while seeing the patient, and if you know the disease, you will be able to recognize that this is a malar rash and it could be SLE. Okay, females you can understand. Females, you can have cloasma or melasma. But what about males? Males don't have this typical rash. If a male shows this, then yes, SLE could be there. Then again, as the disease evolves, this malar rash does not remain malar rash only on the face. It starts coming on the entire body, particularly in the trunk, then the back, and certain parts of extremities. They are circumscribed rash. We have a rubric in this chapter of skin called as rupia, R-U-P-I, rupia. Rupia means rupees. That is it's a circular type of rash. And it's very different from tinea. Tinea also has got a circular type of rash. Ringworm. So it's different from ringworm. It's a more reddish colored rash, a more red color. Doesn't have a definite margin, but it is roundish in shape. So that is body rash, and it has a characteristic aggravation in heat or sun or heavy light. So the rash, it is a non-itching rash initially. Occasionally, it may itch in some people, but then definitely it is hypersensitive to sun or photosensitive. These are initial when the inflammatory phase is developing in SLE. You have this. Then some people may show a predominant skin affection with alopecia areata and painless apathy. Apathy means small ulcers on the palate, soft palate initially, then the hard palate, and then finally the tongue. They are non-bleeding. So that is why you can't give drugs like borax. You have to start giving drugs like Rus venerita, where Rus ven. So painless apathy. Alopecia areata, we'll see about when we talk about alopecia areata, we'll talk about certain drugs. Certain people can have polyarthritis as the predominant feature of SLE, and it is very difficult to differentiate between SLE and rheumatoid arthritis and rheumatoid arthritis-like disorders, psoriatic arthropathy, etc. So polyarthritis and early morning stiffness, which is also the same thing which we see in rheumatoid arthritis. Certain people will show headaches, and those headaches are not like migraine, unilateral or bilateral. It's a complete headache. It can be associated with certain time period of the day, like evening, when the patient has got excess of fatigue, feverishness or fever, along with headache and dizziness. And that is not dizziness. It's a sense of imbalance. When the patient, doctor, when I'm sitting, there's no problem. But when I stand up, initially I feel that I'll be able to fall. I'll be falling. This is the sensation of sudden losing the balance when you are changing your position, or when you're attempting to walk, the person feels as if I am going to fall. So this is dizziness, not the typical dizziness or dullness of gelsemia, but more dizziness of Argentine nitricum. Then, because the person who is otherwise working well is not able to give him his 100% or her 100%, you start feeling depressed. What is happening to me? Why I can't be my full self? And then you start losing interest in your own things which you used to love once. Now you start withdrawing because you physically can't do much, and that's why the patient goes into depressive phase. And depressive phase, it's very difficult to control because you can't explain to the patient that no, nothing happens, you should take time off, your body is speaking this, that, so many psychotherapy one can give. But then yes, person definitely feels a sense of depression, and but that depression is not a very big depression. Only thing is that it is unable to give his or her 100%, unable to work properly. If this SLE progresses further, then you have metabolic disturbances, and it may lead to confusion. And if it is CNS predominant SLE, then it may lead to seizures or convulsions. The inflammatory phase of SLE can show unexplained recurrent abdominal colic. In fact, yesterday itself, I had a male who is 26 years old, and he has been brought to me. Yesterday, he was brought to me by his doctor. And the doctor himself accompanied the patient. They came to my clinic, and he has been complaining since past 1 year of unexplained recurrent abdominal pain, which is fixed in the epigastric region, non-radiating, and the pain is so severe that every single day he has to take injections of abdominal painkillers, whatever they must be giving. Now I kept on asking him, what is the reason? Why did it start? They have done a CT scan, they've done an MRI. Initially they did this sonogram, everything was normal. The only other symptom he has got is fatigue and feverishness, but no fever. And followed by painless apathy. Plus, he has got loose motions, not diarrhea, but the stools are loose and he cannot control it. So as soon as he eats, he is fearing to eat because the moment he eats, the pain starts. This was the situation yesterday. So they had come early in the morning, but 11:30 they had come to my clinic, first case, and the entire symptom syndrome, he had lost 9 kgs of weight in past 1 year. I asked him the history, nothing, 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 nothing. I said, it's not possible, nothing. There has to be some reason for doing that. And he had already been started with anti-cox treatment, that is anti-tuberculosis treatment. First 3 months, it's practically a year or more. So when he started complaining, the first 3 months, they started him anti-cox, absolutely no response. In fact, he developed hypersensitivity to a drug called as rifampicin, and that is why they had to stop in between. And this person, slowly and steadily, since October more, he has started deteriorating. Of course, I just saw his ESR. ESR was pretty high. It was 94. And I said, definitely this person is suffering from some autoimmune disorder. Now, the place where they had come from is a small town. It's not a very big city. It's near Nagpur, so not a very big city. Earlier, in the morning itself, I wrote for another ESR and ANA and DSDNA. And by evening, it was confirmed that this person has got definitely SLE. The way he presented is fatigue, feverishness, fever, no rash, still not developed the rash. Headaches, dizziness, depression, but no confusion or seizures, an unexplained recurrent abdominal colic. And then I palpated his this lymphadenopathy. He has got lymphadenopathy in the inguinal as well as axillary lymph nodes. Prominent, painless. And then I asked him why. After repeated questioning, he did not utter anything. Ultimately, it was his brother also had come. I said, something has happened year ago or before 1 year ago. And he said that it was love affair and that girl had left him and he is still yet to come out of that shock. So a man bringing SLE. Of course, the drug is very clear and I will tell you what the drug was once we see the next slide. So the inflammatory, fatigue, feverishness, etc., headaches, dizziness, depression, confusion or seizures, unexplained recurrent abdominal colic occurring practically at the same site and with no radiological findings. Unexplained lymphadenopathy. And you'll have big lymph nodes. I mean, you can palpate those lymph nodes, but generally they are painless lymph nodes. Or you can directly present yourself, the patient can present himself as glomerulonephritis or chronic kidney disease with edema under the eyes and edema on the feet. Initially, the edema comes and goes. Like today, was a morning, I'm completely normal. But as the day develops, in the evening, the edema is more prominent, or vice versa. The daytime, it's okay. But once I sleep at night, early morning, my face is puffy and my feet are swollen. This can be a symptomatology of SLE. So these are inflammatory, not necessary. All can occur. Any one can occur, and you have to actually think it could be SLE. Then you can have symptoms of vasculitis. And since we are talking about vasculitis, the two prominent pathological drugs for vasculitis are in homeopathic mathematica, kali iode and natrium iode. How to use them is something which we'll tell you later on. But kali iode and natrium iode only for vasculitis. And how does vasculitis present? It can present as chest pain because of pleurisy, recurrent pleurisy. That is pleural effusion, not pleural effusion in fact, but pleurisy. The pleural membranes are thickened. Or you can have valvular regurgitation, mitral regurgitation, aortic regurgitation, pulmonary regurgitation, tricuspid regurgitation. Or you can have pericarditis or myocarditis, and that causes breathlessness on exertion with chest pain. Breathlessness on exertion with chest pain, and the chest pain is this. Doctor, my entire chest pains. Here, this is SLE, or this could be an autoimmune phenomenon. Whereas an angina person whose arteries are blocked, they will say, doctor, pain is not much. It is here, here, here. This is angina of atherosclerosis, and this is vasculitis. This is autoimmune. Muscle pain will be there. Pain will be very generalized. It will involve this muscle plus the heart and the myocardium, etc., and the pleura, etc. Then you can have iridocyclitis. Iris and the pupils, they can undergo inflammation. And you can have Raynaud's phenomena. Raynaud's phenomena is when the person is exposed to cold weather, slightly cold weather, the arteries, they constrict and they turn, the fingers turn blue and very cold, typical like cecal core and agaricus, which we have got extreme, very good drugs. This is a Raynaud's phenomenon. And they are very painful also. Vascular pains are there. And since we are talking about vasculitis and vascular pains, then we have to talk about a few drugs like Vipera, which is the number one remedy for any vascular pain. Severe pain as if the limb would burst, aggravated by hanging down. Now we are talking both lower limbs as well as upper limb. The person cannot put the hand down. They will always have to take or support the hands or on the armchair. The moment they put it down, pain starts. And the drug is Vipera. The area becomes swollen and sensitive and better by elevation of the limbs. And suppose if this blueness starts turning to slightly icy cold and great spasmodic pain, then the remedy is cecal core. The pain of fingertips and toes aggravated by heat is cecal core. And when you touch the arms and forearms or the area, they are very cold to touch. But the patient cannot tolerate heat at all. Arsenic, on the other hand, needs heat. So even if you have got burning pain, aggravated burning pain, but patient wants heat so that the fingers get more agile. So arsenic has got burning pain, aggravated midnight, cold, and better by heat. So cecal and arsenic are very closely related to each other, but aggravated by heat and ameliorated by heat is aggravated by heat is cecal core, ameliorated by heat is arsenic. And then we have got agaricus, where you got, because of vasculitis, we have cramps in the calves. The sensation is feet are frozen, aggravated open air, cold, and better by slowly moving. Cannot move fast because the patient cannot have a sense of balance. It's very painful to move, and yet the patient slowly wants to move. Since we are talking about vasculitis, vascular pains are very bad and very difficult to treat. And you have got very few drugs, actually clinically good drugs to show results. And they are Vipera, cecal, arsenic, and agaricus. Then the SLE can present as thrombotic state, particularly in pregnancy. Antiphospholipid antibodies. There are particular type of antibodies which are there in SLE, and they start depositing and they cause anemias or cytopenias. And you should think of drugs like Botrox, calciricab, carcinosin, and not simple carcinosin. Carcinosin hematological, the special variety of carcinosin prepared from blood. Protalis horridus, X-ray. TNT is a drug called trinitrotoluene and benzene. My dear friends, yes, you are not always successful in clinical practice with all cases. But if you have knowledge of these so-called rare drugs, if you want to treat such cases, you have to have the knowledge of these so-called specific drugs. Trinitrotoluene, X-ray. In my first case of my practice, of my life, the first published case was a trinitrotoluene case, which I have done. And I'd given that patient, the case of SLE only, 16 years old girl. She had come with pancytopenia and she was diagnosed to be SLE. The only symptom was pancytopenia. And there I had given carcinosin and I had given trinitrotoluene. And along with a few other therapies, we could actually give her a better life when she had come to us. The female, the girl remained with us for about 2 or 3 years and then left the treatment. I don't know how is she now, but then all of those 2 years, my first case, they have a tremendously good response. And that's a time I realized when these so-called rare drugs are so important in life when you for a homeopath to know. So today they may be names for many people. You may have never not heard of these drugs, but now once you have heard it, and SLE, these diseases are not very uncommon. Post COVID, we are getting so many varieties of autoimmune diseases. I believe if you start using those drugs, benzene, fantastic medicine. I mean, the way it shows changes in the complete blood count, the TLC and the DLC, the way it shows, it's really beautiful. Then it can present, SLE can present in the form of emboli or infarction, where both drops of Viper has to be thought of. There's a rubric in the chapter of chest, intense repertory, where it is written bubbles, starts from the heart and goes via the arteries. And the only drug mentioned there is natrum phos. But it's not a sensation. Actual drug is either both drops of Vipera, and that rubric signifies nothing but embolization. So all of you have attended the school. I make it a point to point out because it's a very, very important rubric nowadays. We are getting lots of patients of emboli infarction, brain infarcts, and myocardial infarctions, and splenic infarcts, and liver infarcts, kidney infarcts. The organ may change. Intestinal infarction. So here you can use both drops and Vipera, and we have used it quite time and again in various forms and treated patients. SLE can present itself as coronary artery disease, angina. And the treatment of angina, people who have seen my ESRA protocol, I believe we can help the patient of angina, whether it is of SLE or whether of atherosclerosis, coronary artery disease can be caused by SLE. Myocardial infarction. So the first presentation of SLE could be MI or CMP. CMP is cardiomyopathy, cardiomyopathy. And here again, I should emphasize our study, the study done in the academy, AD study, PADS, P is fasciolus nana, A is adonis ver, D is digitalis, and S is strophanthus. And these are the 4 drugs which we have been using left, right, and center for different presentations of cardiomyopathy, the different types of cardiomyopathy. The SLE, you can use this. Now, finally comes to the management of SLE. How do you manage? So as I said, you can get SLE. I mean, you may not know that the patient has SLE, but the patient can present as a form of emergency in any of these other aforementioned symptoms, or can have one single symptom, acute symptom, or 2 or 3 acute symptoms for you to deal upon. Or you can have SLE in a chronic active state or a chronic settled case. These are the 4 different types of presentation of an SLE patient that come to a homeopath. Most patients who come to homeopathy generally are diagnosed. You may be very lucky if you can diagnose an SLE yourself and start a treatment in a virgin case. But then most who come to us, they are already on homeopathy. They are already on certain therapies like hydroxychloroquine, HCQ, hydroxychloroquine, steroids, methotrexate, and azathioprine. They are immunosuppressant drugs, and greater than them, methotrexate, azathioprine, the latest one, rituximab or cyclophosphamide. And mind you, friends, all of these drugs, hydroxychloroquine, steroids, that is cortisone, methotrexate, azathioprine, rituximab, and cyclophosphamide, all are potentized, and we use it in homeopathy with great, great success. Not only for management of SLE, but for management of so many other disorders where these are used. So hydroxychloroquine, the resemblance is just like China, quinine. Of course, certain more symptoms are there, but very much similar to China, more than China. It is Chinum sulf, which is hydrochloroquine, proving it's similar. Cortisone, we have a well-proved drugs, I mean, well-proved remedy. Methotrexate and azathioprine, rituximab and cyclophosphamide. So methotrexate and cyclophosphamide are partially proved. Azathioprine is not proved so well, and rituximab, I have been trying for a pretty long time in my patients. So when the patients come to us, what I do is I try to focus on ailments from to start because those ailments, these people are so jumbled up. I don't know where to start. So the one key, one entry point in the case. So homeopath has to understand where to enter the case, how to enter the case. So one of the first important things which I look for is ailments from to start treatment because that ailment from, and if I can connect that ailment from to the entire event, then I know that I'm going to do a substantial good to the patient who has come to me. If I'm unable to find out that ailment from, then probably it will be a sad thing. But anyway, on my part, for any ailment, whether it's a heart attack, whether it is a kidney failure, or whether it is SLE, for me, why? Why has this organism brought this disease or disorder? A, and B, why is it maintaining the disease or disorder? I need to know the exciting factor and the maintaining cause, which is aphorism number 7 or 8. And in your, I mean, the language which you'll understand is causa occasionalis. Having said that, initially palliative homeopathic medicines are used, and once settled, then the patient is prepared to receive the indicated. And in here, I will not say constitutional; it's indicated drug. That means multiple symptoms are there. If I can repetize very well and good, if I can complete the symptoms very well and good, if I can find the PQRS very well and good, so single symptom or multiple symptoms, so indicated similarly in ascending potencies. And here, 10th octave scale is a very great boon. So you don't keep on changing the drugs, but you take the same drug and keep on repeating it every time the patient comes. Don't change the drug. So last time also I said sa re ga ma pa dha ni, not sa again. So starting from say if you're in a centesimal scale, 30, 200, 1M, 10M, 50, 50M, and CM. But in my case, I go for 30, okay, then 30, 31, 32, 33, 60. All these drugs we only prepare. I mean, I don't believe the principle right from jumping from 30 to 200 and from 200 to 1M. You can give 200, 300, 400, 500, 600, 700. There's a method. So we are taught in pharmacy and we should make use of that knowledge. And I mean, if the drug is not available, say aurum metallicum is not available in 900C and I want in 900C, then I should be able to prepare it from 200 potency to 900C. So initially, palliative homeopathic medicines are used. Once settled, then the patient is prepared to receive indicated similimum in ascending potencies. At the same time, I may try to gradually taper off allopathic, Ayurvedic, Unani drugs or something else with symptomatic replaced by homeopathic drugs. Counseling the patient and the caretakers. See, both are important. Neither the patient knows the disease completely, even if he or she is a doctor. When it comes to us getting the disease, then you become blank. For judging others or deciding for others is very easy for a professional. But when it comes to self, then you're completely blank. You don't know what to do and what is happening to you. So that's why even if the patient in front of you is a doctor, they may use big terminologies, let them. But then they have to made to realize what they're actually suffering from. One, how the homeopathic system of medicine works. Two, and what is your system of homeopathy which is you're going to give the patient. Like we have seen so many different homeopaths approach following a very different approach. But the patient has the right to know what the method of would be there. At least I feel so. So I tell my patients how the therapy is going to work. What history I want from you. I tell the patient. Not only the patient, but the caretakers. See, the patient is a patient. What is more important for the patient is the care. And those caretakers need to be made to understand in a professional manner what they have exactly to do, how the care should be given to the patient. So the patient and caretakers have to be counseled so that they can understand how homeopathy can help them so that you get efficient results. Then we keep on talking about individualization in so many forms. Individualization in drug selection, individualization in potency selection, this and that. So also we have to talk about individualized exercise program, individualized diet planning, what the patient craves. Can we give it or not to the patient? Like for example, if a sulfur argent is with you and patient wants sweets all the time, they can't do without sweets and you don't want to give them sweets. So then you have to find some alternative, right? Because whatever diet want to give, you want the patient to continue for a long time. The compliance rate should be high. Otherwise, you lose the entire battle. The patient is with you for, say, 15 minutes, 20 minutes, half an hour in your chamber. But after that, the patient and the caretaker, they only two together. So individualized exercise program, what will be beneficial to the patient is important. Not all exercise is important. Diet planning is there. Individualized meditation again is a very important thing. Here comes the knowledge of homeopathy and your drug selection, drug as a person. If I know I'm dealing with a Naxwamika, the type of meditation I will suggest is different. I will just not utter the word do meditation. Instead, I will tell what meditation to be done in a Naxwamika person and a Natramur person or a CPR person and so on and so forth. Individualized meditation. Then encourage hobbies. And if they don't have a hobby, then we try to develop one, inculcate one. It may be very late in life, nonetheless, but encourage hobbies and encourage sports. There's always an element of depression, and the depression keeps on increasing to a point that the patient may commit suicide. So this depression should not take away the entire patient's life, whichever is remaining. Hence, hobbies and sports are important. People want to exercise, and all these patients have an element of fatigue, which I have first mentioned. So even if I want to exercise, but I get so much fatigue, so much exhausted that I don't want to move. I get up early in the morning, 4 o'clock, but it is so exhausting for me to go and do some exercise. That's why I don't do. Day one, 1 month, 5 months, 1 year passes, and I've forgotten that I ever wanted to exercise. Why? Because of the fatigue. Okay. What you want to do? You can actually give them massage. Massage is a very good method wherein the suppleness of the muscle is maintained and the patient may start exercising again. Or physiotherapy exercises. Go to a proper physiotherapy, but most of our patients complain that physiotherapy, I mean, it's not a complaint, it's actually genuine. They can't afford physiotherapy for a long period of time. It's actually costly. So 15 days, month, 2 months, okay. Same way with massage. That's why we have to train the family members or certain people in the family who can massage to massage the patient. Because long time masseurs also take a lot of money according to patients, what they tell us. If a chiropractic practitioner is available or acupuncturist available or acupressure is available or you know any of these things, please inculcate it with homeopathy. It's a very good method of management and a lot of our drugs need not be given if these are followed. I as a homeopath would see that I have to give minimum medications. I don't want to give drugs. If a person can do massage and if the exhaustion, that fatigueness is gone, the bony pain, the muscle pain is gone, or by acupressure or pressure. Why should I unnecessarily spoil my drugs? Then modify the maintaining factors, like the mental stress. The word mental stress is okay, very easy to say. What do you have to do? You have to do something with the mental stress. No? The patient can't do anything about the mental stress, his or her. You have to show them a method how to solve that mental stress. So for that, you have to know, a doctor has to know what exactly are the mental stresses. Even after half an hour of 45 minutes of counseling, this man of SLE, the case which I just presented, he did not tell me anything about his girlfriend. Anything. In fact, the girl wanted to marry. The family was ready. His family also was ready. Were ready. I mean, and to see the problem, he was not ready to get committed. He loved the girl loved him. Fine. The families, both the families were ready. But he did not want to commit. And he did not want to marry. He only wanted this relationship to continue for as long as possible. And the girl said, how is this possible? I mean, it's illogical in the Indian society, particularly in the village where they live. Either you marry or don't marry. But this cannot continue to halfway in between. So she waited for a particular long time, and this was going on since past 3 years. Eventually, she gave up. She had no choice. So the entire fault lied with this man, and he did not speak to me. Now what are you going to do? He is married, happy, unhappy, that's a separate thing. But now this man, for 1 full year, has totally gone down with the label of SLE now. And he started drinking then. So he started drinking and the alcohol started drinking him. So he became an alcoholic as well, along with addictions, smoking again. So smoking, alcoholism were there, mental stress were there, physical inactivity because he could not move. Every time he wanted to do something, excess fatigue and abdominal pain. He was not obesity, he had lost weight, in fact. So you have to modify maintaining factors. So if you have obese, I mean, we're talking about morbid obesity and not just being fat. It's not obese. If you're rapidly losing weight, then what to do? We'll tell you in the next slide. Emotional support to tackle depression. If you are trained to give emotional support, so I believe that every homeopath should be trained in psychotherapy. At least a 6 months course of psychotherapy, if you can do it any point of time, it's a professional course, is absolutely imperative. You cannot always, and you should not always send the patient to other people for doing your job. Like you can train yourself. I give psychotherapy to my patients myself. I've been trained in that. The emotional support to tackle depression and anxiety that are frequent accompanied with these diseases. Patient education. The patient has to be educated to take charge of their own recovery. You have got the disease, so it's your duty to get well. So if you want to, it's the first question I always ask my patient, do you want to get well? After taking the entire history, my first question is, do you want to get well? If yes, then you have to take charge of the recovery. I'll be a helper. As a doctor, I cannot take the entire onus of treating the patient on myself. No, I am just a helper. I will help with advices. I will help with medication, and I will help with counseling. That's what my job is. And that's what all our jobs are. As a healer, we are limited to this. But the patient who has brought the disease has to heal himself or herself. Since we're talking about SLE, we have to talk about management of polyarthritis in SLE or arthralgia in SLE, nephritis and dermatitis, which will be covered in future slides. Now, exciting factors, I told you that ailments after vaccination. But many people are confused. There are 8 drugs for ailments after vaccination. So which drug to give? Then carcinosin or vaccininium or malindrinum, silesia, thuja, antimtat, totalis oris miseria. People who have attended my previous lectures, they must have seen this slide, but then nonetheless, it's always important that I show again and again. So whenever after vaccination, if you can clearly establish that after vaccination, a person has developed autoimmune disease, irrespective of the name. It may be irrespective, that is SLE, rheumatoid arthritis, etc., etc. Then the remedy of choice is simple carcinosin, which we get, that's skininum. Or cancers directly after vaccination. Severe organ dysfunction after vaccination. Diabetes type 1 after vaccination, for example. Then you have got carcinosin. Autism, schizophrenia, tics, neurodegenerative disorders like Parkinsonism, metabolic disease like hypertension, diabetes, ischemic heart disease, insomnia after vaccination. Then the remedy of choice would be carcinosin. On the other hand, If after vaccination, a person has developed nephritis, migraine, infertility, glaucoma, vitreoretinal degeneration, erythema, that means any red rash, keratitis, or ulcerative colitis after vaccination, then it is vaccinum. So ulcerative colitis is a bit specific for vaccinum, or else you can use carcinosis as well. That doesn't make a great difference. If after vaccination, the first presentation is metastasis, you don't know the primary. The patient is presenting with general symptoms, and on screening, they found that the person has got metastasis or psoriasis, which is an autoimmune disease again, or peripheral neuropathy. Then the remedy of choice is malandrinum. After vaccination, CSOM, chronic suppurative otitis media, or caries of the bones or teeth, which was not there initially. Caries means degeneration and destruction of the bones, long bones or the vertebra, whichever. Constipation, more than constipation, it is obstipation, obstinate constipation. Initially, before the vaccination, doctor, I used to go for stools very, very regularly. And I was always fresh. But now, 2 days, 3 days, and then I have to go for stools. It's very, very hard. And I have to keep on taking some drugs, laxatives here and there. So, constipation, obstinate constipation, fistulas, acidity, unusual acidity, corneal ulcer, and dementia. So then the remedy would be silesia. Now, keratitis and corneal ulcer both look same, but they are not same. Keratitis is just inflammation, whereas corneal ulcer is actually an ulcer, diagnosed ulcer. Okay. Likewise, neurodegenerative diseases and dementia. So carcinosin can be given neurodegenerative disorders, whereas only for dementia it is silesia. Or after vaccination, you have got rheumatism, irrespective of the name, ankylosing spondylitis, or rheumatoid arthritis, or polymyositis, so on and so forth. Or brain tumors, cysts anywhere in the body, pelvic inflammatory disease, and stones, whether gallstones or kidney stones, and the recurrency is there, the remedy is puja. If it's asthma, interstitial lung disease, which is again an autoimmune disease, chronic obstructive pulmonary disease, tuberculosis, sarcoidosis, primary arterial, pulmonary, what is it? Huh? Pulmonary arterial hypertension, PH. Remedy of choice is antimplat. Irrespective of symptom, you may not have symptoms of antimplat, but if you link it with vaccination, then the first remedy of choice would be antimplat. Or you can have blood disorders like ITP, idiopathic thrombocytopenic purpura, anemias, pemphigus, amenorrhea, then crotalis horridus. And if after vaccination one has abscess, recurrent abscess, or eczema, or excessive leukorrhea, then the remedy is miserium. So at least we use this chart, and in my practice, it took me a great deal of time to understand, after a lot of discussion with the entire team, which drug to give when. So this is what we have followed, and we are very successful in that. And that's the reason why I'm sharing it with you. Now, the second slide again, after this, is again a very, very important slide. Please see that. And this slide, which I'm going to show later on, you have not seen it before. And this is game that emotions play, ailments from emotional disturbances. So you have got for each, they are all from repertory and they are also from clinical practice. But then in repertory, you will always find the same drugs, always Staphylococcus and Ignatia and Natramur and Lycopodium, Lachesis. These 4 or 5 drugs come up. Wherein here, at least these 2 slides, we need. So this was the first slide of my ISRA protocol, ESRA, and I have elaborated that slide. So ailments after anger. If that anger was expressive, and still the autoimmune disease took place or the symptom came away, then the drug is brinium. And if the anger was non-expressive, the remedy was colocin. Both are angry drugs, brinium and colocin. But the manner was expressive and non-expressive, and the autoimmune disease after that event. Sexual abuse. Lots of people we get ailments after sexual abuse, and that female or the male or whosoever the person has expressed to his or her peers or parents or someone, and yet have got this symptom syndrome, then either aconite or ignitia or platina. You know, normally don't think of platina in an acute state, but here we have. And a non-expressive person would have staphylococcus, natramore, and carcinosin. That Ca is carcinosin. Just a minute. Yeah. Ca is carcinosin. Okay. If the person is insulted alone, heavily insulted, and vice versa, the person also has insulted back, and yet carries that grudge and starts the autoimmune process, then it's nux vomica. Whereas non-expressive, it is staphylococcus, and the patient is publicly insulted and given back, but still has the grudge, and veratrum malvenlacesis, and non-expressive anacardium. Anacardium is a very, very bad remedy because they hold grudges for a very, very long time. And to their core, until the revenge is taken, they will not sit still. Anacardium lachesis, they have a worst revenge in our Metra Fear. Expressive fear is aconite and nausea. Non-expressive is opium and carcinosin. Grief. Expressive means the person is showing a symptom that yes, I am grieving, and non-expressive means I have not. They have taken inside and give it the autoimmune disease has come up. So acid phos and natramore. Bad news ailments from gelsemium and chamomilla. Ailments from joy, Ceres bonplanti. Ceres bonplanti is a very small drug, a relative of Cactus grandiflorus. And non-expressive ailments from joy are coffee and lachesis. Very few people know that lachesis also has got ailments after joy. Shock. Immediate expressions would be from aconite and arnica. That means in the early phase, you can give aconite or arnica. And we have got ailments after shock, but delayed symptoms, then opium and picric acid. FOMO. This is a very, very important word in the lingua of Gen Z today. Now we have got which Gen? Alpha, beta. So beta is already started, right? So Gen beta and Gen alpha. So they have got this ailment from FOMO. FOMO is fear of missing out with immediate effects. You can have pulsatilla and cyclamen, and delayed effects, argentum nitricum and sorinum. Now, who would think of FOMO being an exciting factor for becoming ailment for autoimmune disease? But nonetheless, we have got certain cases, and that's why the rubric has come. That's why this symptom has come. If the person feels abandoned, and if the autoimmune disease is an open system means GIT, anywhere in the GIT or RS or skin, then the remedy of choice would be stramonium or monksol. And closed systems, orometallicum and lachesis, like CVS, CNS, musculoskeletal, etc., etc. If the feeling is abandonment, I have been abandoned, or lonely, if there is a loss of respect, the immediate effects would be there with lycopodium and long-term effects of aurum metallicum. Both lyco and aurum cannot handle loss of self-respect at all. They are bound to show effects. They are bound to show effects. But then lyco and aurum metallicum, aurum is much, much deeper. Lycopodium is there, but lesser than aurum metallicum. And this when I say lesser and deeper, you have to actually go in the depth of the drug, and you'll understand what I mean by this. I can't just explain it in words. If the person is feeling betrayed, Then the immediate action, I mean, the immediate response, if the symptoms are there, the tackling drug would be ignitia, and long term would be natural mode. Shame. Shameful. I mean, if the person himself or herself has committed a particular crime and feels shameful, or the family members have committed a crime and she or he feels shameful, and they have brought a disease, then it is thuja, Staphylococcus, Natromur, and I should add one important drug, and that is Colchicum. Ailments from misdeeds of others. Now, others have done the misdeeds, but I am feeling shameful for them. Now, why should I feel okay? I feel shameful for them. That's okay. And after that, I get symptoms of ulcerative colitis. Now, this is very peculiar. And yet, we have got patients. A third person doing something else. My neighbor's son has done something wrong. I am feeling guilty of that. Now, why should I feel guilty of that? That's a total different thing. And okay, I feel guilty of that, and yet I bring symptoms like ulcerative colitis. How do you tackle such patients? The remedy is colchicum. I have not mentioned it here. It's shameful for me to face other people. Now, I have done nothing wrong. Neither my family, immediate family, but my neighbor's son has done. This we get such type of patients also. Ailments from violence, self-violence, or if I've been a part of the violent mob, or I've seen violence, cough-a, Staphylococcus and carcinosin. Staphylococcus and carcinosin have experienced that violence, whereas cough-a has only seen the violence, not experienced himself or herself. And yet, they have brought symptoms of autoimmune disease. The reason why I'm telling you differentiate, otherwise you'll never be able to differentiate, because so many 3, 4, 5 drugs are given in one rubric and they are not similar. Ailments from being reprimanded. Reprimanded means scolded. If the symptoms are in the open system, like GIT again or skin and RS, then the remedy either tarantula or moscus. And closed symptoms is carcinosis and staphylococcus. Ailments from jealousy, expressive. If the patient expresses the jealousy and yet brings the disease, then lachesis, Ohiosamus or Nux vomica, and non-expressive, then Apis and Sencris. Patients nowadays are bewitched. Many people say, I have it, doctor, someone has done or playing an evil eye upon me. I am under the influence of evil, superstition. You may call it whatever, but the patient strictly feels that my brother's wife is doing something upon me, and that's why I'm getting maybe this. No, that's the patient. Are you how it's maybe we call it delusion, whatever you want to call it. Yet the patient suffers and brings on the entire disease process. So the immediate effects would be calcarea carb, chin himself, and kali iode. Or deep effects would be phosphorus, lachesis, and sorinum. Ailments from being bewitched. Bewitched means as if being influenced by an evil eye. It's a very, very common phenomena, even in urban centers, and not only in India, everywhere in the world. People still feel that they have been bewitched by evil eyes. And it's very difficult to convince them. Otherwise, forget about convincing them, but they still bring on big, big disorders like SLE and rheumatoid arthritis and so on and so forth. Now, certain drugs you need to remember when you have got long continued grief for 2, 3, 5 years. A grief has been endured. The patient is taking to heart and somehow living the life and somehow suffering. The drug is argentum nitricum or causticum or nux vomica. Sorry, natrium. Argentum nitricum, causticum or natrium. Grief is okay. Long anguish. Anguish is a very painful grief. See, you may be sad. Sadness is grief. That is one part. But then it's painful. At any point of time, you think of that person, it causes a deep pain. Because either the death of someone or loss of someone has suddenly moved away, or you have moved to a new city. Yesterday itself, we had a patient but a malignancy of this lip, buccal mucosa. So left side buccal mucosa. And he was 42, 42 years old male teacher and coming to us. And I asked him since how long. So it's been there since 1.5 or few months or whatever. And the reason was he has shifted from Bangalore to his native village. So when he shifted, he had a very good work culture in Bangalore and so really like working there. And then because of that, he wanted to go to his home place. There also they had this his office, so he shifted there. But there the work culture was very bad, and he was totally taken aback. And with this work culture, he was just pulling on, pulling on. Chronic smoker since a long time. That's okay. But then chronic tobacco chewer and smoking did not bring malignancy. Only after that coming to that being transferred, he had a very non-congenial environment. One of his superiors used to continuously taunt him, and he could not bear that taunt. Neither his other co-workers were so he was actually having a severe loss of loved people, a loving company, which he of a loving work culture which he was getting in Bangalore. And very soon, in 1 month's time, he brought a full-fledged mass, and he was just about to operate before he came to us. And I said, how much ever you wanted to operate and all. First, what you do, you go back to Bangalore where you actually become happy. You cannot stay to a place and work, keep on working, and then expect that cancer to be, even if you cut that cancer, it's going to come on the left side. She had a left side cancer, right side cancer. Left side, left lip cancer. Uh, you cut this, the entire thing, it will come to the right side. Because you have not taken care of that ailment from. Of course, we gave him carcinosin, and the next drug would be aurum metallicum, irrespective of the sites, and he would be taken care of. But at the same time, he has to go back to Bangalore where he actually liked living. Long continued nursing, nitric acid. In all my lectures previously, I have given you enough cases, but then I'm not, time is short. Some people, now this is especially for mothers, long continued worry. Why are you worrying? No, bus. It is my habit to worry. Mothers keep on worrying. See, concern is one thing, and worry is totally a different thing. And people keep on worrying. They may start getting symptoms initially, like for example, GI symptoms, IBS, and then IBS, and slowly, then you said that doctor, I have got blood also in my stools, and I've been diagnosed as Crohn's disease or ulcerative colitis. So long continued worry, and the first drug of choice is calcaricum, and it is a fruitless worry. It's not a genuine worry. Or argentum nitricum, or nux vomica, or phosphorus, or causticum. These people have tendency to keep on worrying, and how much you tell them, they don't. So generally, parents, they need this ailments from long continued worry and long unhappiness, either in work or relationship. His drug is ignitia or pulsatile. It's very, very important to be happy. And only happiness leads to peace of mind. So these are the games that emotions play, irrespective of any disease, particularly when you're dealing with drug diseases like SLE, which are so varied in their clinical expressions. You need one important ailment from wherein the disease has started, and you can actually progress forward. Then certain nosodes are very, because SLE can have very bad flare-ups, and that flare-ups, person may need to be admitted to ICU or a critical care unit. And it is here, my dear friends, you have this nosodes who work very, very well in your armamentarium. Medurinum for shock. When carbovec and viratriptan valve is indicated but fails, you have to give it low potency. Now, this is an area where nosodes can be given low potency. And when I say low potency, at the 0/1, 0/2, 0/3, not exceeding 0/3, or 1C, 2C, 3C, 6C, not exceeding 6C more. Or when we wean off the patient from ventilatory support, or the patient has got incessant cough, and you have tried spongia and mephitis and so many other remedies, and yet the cough is not stopping, it is becoming an emergency. Give medurinum, curtail the cough. Same way with pyrogenum. High continuous fever with tachycardia, and I've underlined tachycardia. So if tachycardia is not there, you cannot give pyrogenum. It is very, very clearly mentioned in pyrogenum that the pulse is out of proportion to the fever. That means fever may be less, but the pulse is severe tachycardia. So in diseases like hepatitis, typhoid, and dengue, wherein you have got fever with bradycardia, you cannot give pyrogen. Pyrogen, you have to have high or very high continuous fever. That does not matter. Remittent fever also does not matter. High grade fever, tachycardia. With body pain, excessive restlessness, loquacity, and sweating does not reduce the fever. That's important. Sweating does not reduce the fever. The person may have chills with fever, thirst for cold water, but as soon as the water taken, it vomits like bacteria or arnica. Normally, I start with 1 impotency or LM10 and keep on increasing wherever need be. Tuberculinum, to control all the biochemical parameters, example SpO2. The SpO2 is falling down and you don't know what to give. You have given carbovate, you have tried laurocerisis, you have tried this and that. You don't know how to increase the SpO2. Just give 1 dose of tuberculinum. Or blood sugar levels. Doctor, my blood sugar levels are sometimes very high, sometimes if it is, this is there, high and low. So to bring a stability, a dose of tuberculinum is needed. Blood pressure, ECG changes, etc. But not electrolyte imbalance. Like tuberculinum cannot correct sodium and potassium, magnesium, calcium imbalances. Okay. Hemorrhage, painless hemorrhage from any orifice. Drug of choice could be tuberculinum. If the other drugs like phosphorus or millefolium or trillium or sabina have acted and failed. Streptococcinum, we'll see the role in rheumatic heart disease, but rheumatic heart disease with rheumatic fever, active rheumatic fever should be there, and a positive blood culture, and the fever, nowadays, you don't need to start with other drugs. You can directly start with streptococcinum if it is proved that you have a rheumatic heart disease. Stitching pain in the chest with every breath is a characteristic of streptococcinum. Staphylococcinum, endocarditis, abscesses, septicemia, pyelonephritis, wherein you have high-grade continuous fever with chills, like pyrogen, along with hypotension and arrhythmias, and a positive blood culture of staphylococci, irrespective of the type of staphylococci. Staphylococcus aureus, Staphylococcus pyogenes, that does not matter. It should be staphylococci. Sorinum, heart failure. Who can think of sorinum in heart failure? But yes, heart failure where dyspnea and cough are better by lying down. The patient is so weak that they can't sit up. If it is sitting, better by sitting up and rocking, it's Kalikab or arsenic. But if you're lying down and patient's better, it is sorinum alone. Or an acute attack of psoriasis with voluptuous itching. Doctor, please do something. I am terrified of the itching. A single dose of sorinum or a repeated in low potencies, you can take care of this. Same malandrinum also has voluptuous itching in dry, scaly skin aggravated by washing. So as soon as the patient has bath, bathes and patient starts itching. So sorinum, malandrinum are two very big nosodes, but they can act as acute remedies when such voluptuous itching is not being relieved by simple drugs like arsenic iode or kali iode or so on and so forth. Cipilinum for nocturnal angina, postcoital angina, acute glaucoma. You don't know what to give, and they can all occur in SLE and other disorders. So whatever I've shown you in SLE can be elaborated or extrapolated to all other autoimmune disease. Carcinosin for hemolytic crisis. It slows down the rapid deterioration. So if the patient is deteriorating every day or every hour, just give 1 dose of carcinosin 200 of 1 and the slows down. Transfusion and drug reactions. You don't know what to give. You can give carcinosin. But at the same time, having said about nosodes, one should not forget the other 6 remedies. One was remaining. Cecal cord. Collapse. And that collapse, like medullarium, is from profuse hemorrhage. Excess hemorrhage, blood loss is there, leading to hypotension and debility and excess thirst. Give cecal cord. Cecal cord is also used for DVT, deep vein thrombosis. Both drops and viper are also indicated. where you get icy cold limb and cramps. Raynaud's disease, again autoimmune phenomena, cecal core is the answer, along with agaricus, which is the sarcoma. Berger's disease, excessive burning and dry necrosis, cecal core, agaricus, picric acid. And threatened abortion, which again is a very integral part of SLE. You can have frequent abortions. SLE patients have frequent abortions, threatened abortions. Use cecal core, stop the abortion. Probably you may save one life and one pregnancy. So after hearing about these 9 drugs, I want you to remember these drugs also. Opium, antimtat, carbovec, nux vomica, arsenic alb, apis, asparosperma, phosphorus, lachesis, tarantula, and sulfur. If you have these in your armamentarium, you can actually take on the challenge of treating autoimmune disorders. Last 2 slides and then I end. How to select a homeopathic remedy in SLE emergency. So, as I told you, SLE, basically you can't cure SLE. I've had so many SLE patients, but this SLE is a very cunning disease. For a particular long time, it settles down itself, and suddenly it may come up with a flare, and that flare is important. And suppose you're called, doctor, I am under treatment since past 6 years. Till now I was all right, but now I've been admitted in a hospital, and you're called actually to treat because it's your patient. And you are how to select the remedy in an emergency. So physician's observations are important. State of disposition. How is the posture of the patient? Movement of certain organs like tongue and lachesis, or pressing the painful parts. If you start press the painful part, the patient bobs. Or sweating at unusual places. Thirst. How is the face of the patient? From there, gives you a clue to select an emergency drug. Or the mental state of the patient, where the patient is very restless, unusually restless, like rust toxin, arsenic, and aconite, or extremely fearful, or in anguish, deep pain, or very depressed, or unusually calm. You have such a bad emergency, and the patient is very calm. This is indication of arnica or opium. It's called a clinico-pathological mismatch. Unusually angry. Why are you angry, patient? No one knows. Very rude, very snappy, like China. China becomes very rude to others, to the nurse, to the people who are caring for the patient. They unusually become very rude. Or a prominent attribute like causation. If you have a causation, then you can select a drug. Modality, then, or a sensation, or any keynote. These are the reason. The methods I use because I deal with emergencies, and by God's grace, quite successful in treating them, because I search for a point which helps me to prescribe a drug. Okay, the drug selection is not only one thing. How to select the potency in an emergency? The first thing is intensity of the presenting symptom or symptoms. Greater the intensity, I would choose higher the potency. Second is sensitivity of the manifestations, like aconite or hipposulf, the pathology is less, but the expressions are out of proportions, and therefore they need higher potency. Arnica, pathology can be gross, but expressions are minimal, so low potencies. The mental state of the patient, greater the awareness, higher the potency. Organ failure, infarction, or failures, low potencies, mother tinctures. And emergencies are the only areas where lower potencies of no sort can be considered, but avoid its frequent repetition. My dear friends, we have just finished SLE today, and there are lots of other diseases to be considered. But in later on, the next time, I'll try to finish that too. If I've got 5-10 minutes more, so I'll finish it off. Is the similimum sufficient? Is homeopathy sufficient? No. When you're dealing with autoimmune disease, you need these drugs like antioxidants. They're not drugs, they're very great helpers, like berry seeds. They're very rich in anthocyanins. Ginger. Every Indian household has ginger and turmeric, and they should be used to the maximum benefit for all our autoimmune disease, particularly when you're dealing with SLE-like diseases. And special food additives like vitamin B12, D3, magnesium, glucosamine, chondroitin. Glucosamine and chondroitin are very expensive, but vitamin B12, D3, and magnesium are not. Use them. They are definitely helpful. When you're using turmeric, one of the important thing is they can increase the risk of bleeding, especially in patients on aspirin. So that needs to be taken care of. Other than that, and ginger, many people who take ginger, like ginger tea and all, they have unusual bout of acidity. So you have to balance that. Okay. Dietary intervention. Now, diets that improve the gut microbiome. See, most of the autoimmune diseases, practically all autoimmune diseases, many people think today that it is because of a leaky gut syndrome. The gut leaks. Now, what is this leaky gut? You can just Google it off and you'll see leaky gut syndrome. And it is here that bowel nosodes come to a very important play. I have yet not discussed bowel nosodes. In future, we'll just do that. So, I have to prepare a diet or give my patient a diet that should improve the gut microbes. And that alone reduces inflammatory markers, enhances cellular repair through autophagy, mechanisms of autophagy. In my center, I use blood group diet very extensively. So O positive and negative have a different diet structure. B, A, B, and AB, positive and negative, they have different diet structures. Intermittent fasting. Some people don't want to follow blood group diet. Fine. You can go on with intermittent fasting and definitely it helps. Intermittent fasting is you have your proper meal, but only in 8 hours of the 24 hours. And the rest of the time, you can have liquid diet. So solid diet is, say, between 11 a.m. to 7 p.m. or 8 p.m. That's it. So in between, you can have 2 or 3 meals, good meals. And the rest of the time, you should have more liquids or nothing. Certain diseases like multiple sclerosis and SLE, they go very well with keto diet. And particularly if you're non-vegetarian, then keto diet can be done easily. It is difficult for pure vegetarians and vegans who are following keto diet. But then yes, keto diet definitely, not definitely, but helps in many people. And then certain people have got Cambridge diet. In fact, when you go to YouTube's, there are several people who have reversed their SLE diseases only by Cambridge diet, like having high protein soups and green tea and fresh green leafy vegetables and fresh fruits. Now, the biggest problem with this diet in India is we don't get that fresh fruits unless you cultivate yourself. And in the market, the fruits are given so many injections to the ripening agents and so many pesticides. I mean, it's elaborate. I don't want to go in that. So unless you are growing your own vegetables and fruits, which I do, I actually grow my own vegetables and fruit because I've got so many patients who are selling those vegetables and fruits, and they tell me, doctor, for apples we have used this, and for carrots we have used this, and I used to I mean I did not even know that they're so good in chemistry that they can invent so many different chemicals for different things. I only knew carbide, sodium carbide or some carbide for ripening agent, but then there's so many different chemicals. I mean, and those things we are going to consume. Why? So it's better that we start growing our own things. At least we know what you're growing. So blood group diet, intermittent fasting, keto diet, and Cambridge diet. You can have any dietary intervention. Immunology and homeopathy. So certain, I'm just giving one example, which are the by Paolo Bellaviti. They have done an experiment. Effect of homeopathic dilutions have been tested on animal models by immunostimulation by ultra low doses of antigens, which is immunological models of simile. Ultra doses of low doses of antigens and the regulation of acute or chronic inflammatory processes. The author suggested that a good therapeutic effect could be obtained in immunodepressed patients by using extremely low doses of these immunity mediators. The pathophysiological state of the experimental animal powerfully conditions the results of any experiment treatment. I'm not going to go into depth. I'm only going into details, the results. Evidence emerging from the animal model suggests supports the traditional simile rule. That means simile similibus curanta, according to which ultra low doses of compounds that in high doses are pathogenic may have paradoxically a protective or curative effect. The treatment caused significant immunostimulation in New Zealand black mice, whereas the Swiss mice underwent immunodepression, which was particularly marked in the case of thymus dilutions. So the New Zealand black mice are immunologically normal, and the homeopathic dilutions of 4C and 12C were used, whereas the New Zealand black stain were immunologically depressed. So this was just one experiment. There are so many other experiments supporting homeopathy in immunocompromised or immunologically challenged patients. Does homeopathy work along with immunosuppressive therapy? Because in the first slide I said, in most of the patients of SLE, they are either on steroids or HCQ or immunosuppressants. So immunosuppressive therapy is a very, very potential therapy. And on top of that, you have to give homeopathy. So will it work? So contrary to the traditional belief, our clinical evidence of 25 years in dealing with patients of AIDs show that the indicated similimum works well, both symptomatically and biochemically, even when the patient is under immunosuppressive therapy, provided your selection of drug is correct and your potencies are correct. So with this, I end today's lecture. From next time, we will go on to other diseases. What about vitiligo? Yes, we're going to discuss about vitiligo later on. Today only I discussed SLE, which was one of the largest diseases. How will come to know that infertility is occurred due to vaccination when the case presents? Well, you have to ask the history and link it. It should be not more than 2 or 3 months. Like suppose if a female comes to you and presenting with second infertility, and they have been married since say 7 years, and they already have a child, and they have been trying since 2021, and 2021 this female has taken 3 doses of vaccination. So 2021 she aborted, and from 2022 till 2025 now she's not able to conceive. So the only one thing which is coming inside probably could be vaccination. So you can link that. ISRA protocol is not shown here, but then that is not very important for you, Rehanna. What is important was those 2 slides which I had shown you. The game of the emotions play. Dayanidhi, hi, how are you? So Dayanidhi is from Hyderabad. Is there any source of literature on drugs prepared from allopathic medicines? Yes, there is a source, but as of now, I don't remember that source. I have read it and we have been using it for such a long time that I don't remember the names of the books now. But yes, people have proved it, and in fact, there's no sort of single book. There are various articles and people, but not in Indian literature, but American or European journals, homeopathic journals. You will find a lot of drugs prepared from various sources like cyclophosphamide and all, which can be used. But don't worry about them. You can prepare it and use them. Known case of SLE since 15 years, but now it's recurrent erythema and redness of eyes after travel. Is this ACE means? Is this means SLE is complicating? It is not. It does not mean it's complicating. It means still that the disease is active. Please, can you differentiate between OP system and open system and closed system? Open system means skin. Skin is an open system. Everything you can see outside. There can be discharges, eruptions. So the miasm can throw out. GIT is open system. Mouth and anus is open. So you can have vomiting, diarrhea, downstairs. It's an open system. Respiratory system is an open system. Closed systems are skeletal system. It's completely closed. TNS, cardiovascular system is completely closed. So now if the miasm is to come out, it has to come out from some either natural source or an unnatural source, like bringing about eruption and then a discharge, or directly from the nose. Like if the BP rises, then you have nasal bleeding. So that's a miasmatic elimination. So that is closed system. Can an SLE patient conceive and what effects? Yes, I can show you a case, but then I wanted to show you a case, a successful case of SLE treated with homeopathy recently. And the patient has a child after many years of abortions, 7 abortions, and now she has a girl child born under our care and even in our hospital. So it's a very successful. Yes, SLE can be treated, and patient can conceive, but not all. Diet about A positive. Well, I don't know, remember it extemporally. It's there with us. You can just Google it, blood group diets, and you come to know. I believe the questions are over. Do you have any questions? So interns are sitting with me here. If they have any questions. Ailments from shock and bad news. Now, shock is you suddenly lose wits, and bad news can lead to shock, but not always a phenomenon. You hear a bad news and you reacted adversely, but it's not a shock, not so shocking. Shock is a stage deeper than bad news, but bad news can lead to shock. Yes. Can SLE cause atrophy of thyroid gland? Not SLE per se, but thyroiditis can cause. So the medicines we learned in emotions play, what potency and dosage should we give? We start with moderate potency like 200 of 1M if you're doing in this centesimal scale, or LM10 and above in LM scale. Single dose. Our patient with AIT is always obstinate, hard to reason with. No, not necessary. Yes. Thank you very much. Remedy for last discussed case. Which last discussed case? Yeah. So he was not happy, no? Ignitia. He had come to a place of unhappiness and brought full malignancy. Is that love affair patient medicine? Which page? I have mentioned 2 cases. I don't know which case you're talking about. Is the love affair patient? The love affair patient, the colic. So, of course, so I gave him staphylococcus only. Obsessed, reasonless. He does not want to marry. Does not want to get committed. Why? No reason. Yeah, irresponsibility. But yeah, but now presently he does not feel I'm not irresponsible. He feels that she has left me. उसने मुझे धोखा दिया. And constantly keeps on thinking about her. One part. And sexual thoughts about her. That's important. That's the reason why staphylococcus. No, staphylococcus does not have this abdominal pain, colic. But I have given him. And in fact, I got a phone call today itself. I told him to report to me. Every day you're taking that painkiller injections. So it's been 1 day, and he did not need to take. Let's see over a period of time. So thank you very much, ladies and gentlemen. See you again next time. And be prepared with lots of questions. I'll be prepared with lots of material to give you. Good night. Take care.